your trusted source for staying vibrant, healthy, and informed. I'm your name, and today, we're exploring a critical topic that could save lives: the hidden signs of liver disease. Your skin, nails, and even your breath might be revealing subtle clues about your liver's health. As a doctor, I encounter liver disease daily in the hospital, and the signs are often visible if you know what to look for. Take a moment to glance at your fingernails. Notice any white lines or unusually pale patches. These could be early indicators of liver issues, such as Muehrcke's lines or Terry's nails, tied to low levels of a key protein produced by your liver. Perhaps you've felt your belly seems unusually full or noticed your skin taking on a yellowish tint. These could signal serious conditions like fluid buildup or jaundice, both warning signs of liver disease. Liver disease is far more common than most realize, but catching it early can be a game changer. In this video, I'll walk you through the top 12 signs of liver disease you can spot yourself. No medical expertise required. From spider-like veins on your skin to an unusual hand tremor, we'll cover everything you need to know to stay proactive about your health. So, grab a notebook, check your nails, and let's dive into this life-saving information together. Stay curious, stay healthy, and let's get started on understanding what your body might be telling you about your liver. 1. Nail changes. Clues to liver health. Your nails can reveal critical insights into liver function, as they reflect metabolic changes in the body. Muehrcke's lines, horizontal white bands across the nails, appear due to low albumin levels, a vital protein produced by the liver. These lines, located in the nail bed rather than the nail itself, don't move as the nail grows and temporarily vanish under pressure. Low albumin often signals chronic liver disease, as the liver struggles to synthesize this protein, essential for maintaining blood volume and transporting nutrients. Terry's nails, characterized by strikingly pale nails, result from changes in the nail bed's tissue, reducing visibility of underlying blood vessels. Normally, nails have a pinkish hue due to these vessels, but in liver disease, the tissue alterations obscure them, leaving nails white except for a thin pink band at the tip. The absence of the lunula, the half-moon at the nail's base, can help confirm Terry's nails, distinguishing them from normal variations. Clubbing, where nails curve and thicken, arises from connective tissue proliferation between the nail and finger bone. This can occur in liver, heart, or lung conditions, but in liver disease, it's often linked to chronic hypoxia or circulatory changes. If you place your nails together and don't see a diamond-shaped gap at the base, clubbing may be present. While sometimes genetic, new-onset clubbing warrants investigation for underlying organ issues, including liver dysfunction. These nail changes are subtle but significant. Regularly inspecting your nails can help detect liver disease early, prompting timely medical evaluation to prevent progression. 2. Ascites. Fluid buildup in the abdomen. Ascites, the accumulation of fluid in the abdominal cavity, is a hallmark of advanced liver disease. This condition often results from portal hypertension, where scar tissue in the liver, cirrhosis, obstructs blood flow through the portal vein, which carries blood from the digestive tract to the liver. The increased pressure causes fluid to leak from the vein into the abdomen, sometimes amassing up to 15 liters, leading to a distended belly that may mimic pregnancy. The discomfort from ascites can be severe, as the fluid presses against the diaphragm, impairing breathing. To alleviate this, doctors may perform a paracentesis, a procedure where a needle is inserted to drain the excess fluid. This not only relieves symptoms but also aids in diagnosing the underlying cause. Ascites signals significant liver damage, often requiring urgent intervention to manage complications. Patients with ascites may experience bloating, weight gain, and difficulty moving comfortably. The condition underscores the liver's critical role in regulating fluid balance and detoxifying the body. If you notice persistent abdominal swelling, seek medical attention promptly, as it may indicate liver disease or other serious conditions. Lifestyle changes, such as reducing salt intake, and medical treatments can help manage ascites, but addressing the root cause, often cirrhosis, is crucial to prevent recurrence. 3. Abnormal veins. Caput medusae and esophageal varices. Liver disease can cause striking vascular changes due to portal hypertension. Caput medusae refers to dilated veins around the navel, resembling the snake-covered head of Medusa from Greek mythology. These veins expand as blood, unable to flow through a scarred liver, seeks alternative routes through small abdominal wall veins. This creates a visible, twisting pattern under the skin, a clear indicator of severe liver dysfunction. More dangerously, esophageal varices are enlarged veins in the esophagus, formed when blood is rerouted due to portal vein obstruction. These fragile veins are prone to rupturing, leading to life-threatening bleeding. In liver disease, the liver's reduced ability to produce clotting factors exacerbates this risk, making variceal bleeds a medical emergency. Symptoms may include vomiting blood or black, tarry stools, requiring immediate intervention. Both conditions highlight the liver's role in maintaining healthy blood flow. Caput medusae is a visible warning, while esophageal varices are internal and often detected through imaging or endoscopy. Regular monitoring and managing portal hypertension with medications or procedures can reduce risks. If you notice unusual abdominal veins or symptoms of bleeding, consult a doctor immediately, as these signs indicate advanced liver disease needing urgent care. 4. Skin changes, palmar erythema and spider nevi. Skin changes are prominent in liver disease, reflecting hormonal imbalances. Palmar erythema presents as redness in the palms, particularly over the thenar and hypothenar eminences, sparing the center. This occurs due to elevated estrogen levels, as a damaged liver fails to metabolize estrogen effectively. High estrogen dilates blood vessels, causing the characteristic redness, also seen in conditions like pregnancy. Spider nevi, small, spider-like blood vessels on the skin, also stem from high estrogen levels. These consist of a central arteriole with radiating vessels, which blanch when pressed. While 1 or 2 spider nevi are normal, 3 or more suggest liver dysfunction, especially in non-pregnant individuals. They commonly appear on the face, neck, or chest, reflecting the liver's impaired ability to regulate hormones. These skin changes are valuable diagnostic clues. Palmar erythema and spider nevi are often painless but signal underlying liver issues. Monitoring their appearance, especially alongside other symptoms, can prompt early medical evaluation. Managing liver health through lifestyle changes, such as avoiding alcohol, can help mitigate these signs and prevent further hormonal disruptions. 5. Jaundice, the yellow warning sign. Jaundice, characterized by yellowing of the skin and eyes, is a classic sign of liver disease. It occurs when the liver cannot process bilirubin, a yellow pigment produced from red blood cell breakdown. In healthy livers, bilirubin is filtered and excreted, but in liver disease, it accumulates in the blood, tinting tissues yellow. High levels can also darken urine to a tea-like color, a further clue of liver dysfunction. Jaundice is often noticeable in the sclera, whites of the eyes, before the skin, making it a key early indicator. It may accompany itching, as bilirubin irritates the skin. This condition reflects severe liver impairment, often seen in cirrhosis or hepatitis. Prompt medical evaluation, including blood tests and imaging, is essential to determine the cause and severity. Lifestyle factors, such as avoiding alcohol and maintaining a healthy diet, can support liver function and prevent jaundice. If you notice yellowing skin or eyes, seek medical advice immediately, as it may indicate advanced liver disease requiring targeted treatment to manage bilirubin levels and underlying causes. 6. Muscle wasting, a subtle sign of liver damage. Muscle wasting in liver disease results from the liver's impaired ability to process nutrients and produce proteins. When damaged, the liver cannot store energy or synthesize proteins effectively, forcing the body to break down muscle tissue for fuel. This is most noticeable in areas like the palms, where small muscles are close to the surface, or the temples, where thinning becomes evident. Muscle wasting can be subtle, making it easy to overlook. Regular checks, such as squeezing your hand to assess muscle bulk, can help detect early changes. This sign underscores the liver's role in metabolism and energy storage. In advanced liver disease, muscle loss contributes to weakness and fatigue, impacting quality of life. Preventing muscle wasting involves supporting liver health through balanced nutrition and avoiding toxins like alcohol. If you notice unexplained muscle loss, especially with other liver-related symptoms, consult a healthcare provider. Early intervention, including dietary adjustments and medical management, can slow progression and preserve muscle mass. 7. Dupuytren's contracture, the Viking disease. Dupuytren's contracture, nicknamed the Viking disease due to its prevalence in northern European populations, involves thickening of the palm's fascia, causing fingers, typically the fourth and fifth, to curl inward, limiting extension. In liver disease, this may be linked to chronic inflammation or metabolic changes, though genetics also play a significant role. To test for this, try the tabletop test. Place your hand flat on a surface. If the palm doesn't touch due to finger tightness, it may indicate Dupuytren's. This condition progresses slowly, often painless initially, but can impair hand function over time. In liver disease, it reflects systemic connective tissue changes. While not exclusive to liver issues, its presence alongside other signs warrants investigation. Treatment may include physical therapy or, in severe cases, surgery. Supporting liver health through lifestyle changes can reduce contributing factors, but genetic predisposition requires monitoring. If you notice hand puckering or finger contractures, seek medical advice to assess liver function and other causes. 8. Asterixis, the flapping tremor. Asterixis, a flapping hand tremor, is a striking sign of liver disease linked to hepatic encephalopathy, a brain dysfunction caused by toxin buildup. When the liver fails to clear toxins like ammonia, produced from protein breakdown, it accumulates in the blood, affecting brain function. This causes involuntary muscle relaxation, leading to a flapping motion when arms and wrists are extended. To test for Asterixis, hold your arms out with wrists and fingers extended. A flapping tremor within seconds suggests liver dysfunction. This sign is often seen in advanced liver disease and can accompany confusion or altered consciousness. Managing ammonia levels through medications like lactulose, which promotes toxin excretion, can reduce symptoms. Asterixis highlights the liver-brain connection, emphasizing the organ's role in detoxification. If you or someone you know experiences this tremor, seek urgent medical evaluation, as it indicates significant liver impairment requiring immediate attention to prevent complications like encephalopathy. 9. Fetor Hepaticus, the breath of liver disease. Fetor Hepaticus, a musty, sweet breath odor, is a distinctive sign of severe liver disease. It results from toxins like dimethyl sulfide accumulating in the blood when the liver cannot detoxify them. These toxins are exhaled with carbon dioxide, producing the characteristic smell. This sign often accompanies hepatic encephalopathy, where high ammonia levels impair brain function. Fetor Hepaticus is particularly alarming in cases of advanced liver failure, as seen in patients with constipation-induced ammonia overload. Treatment focuses on reducing toxins, often using laxatives like lactulose to clear ammonia via the gut. This can reverse symptoms, including unresponsiveness, highlighting the gut-liver-brain axis. If you notice a persistent, unusual breath odor, especially with neurological symptoms, seek immediate medical care. This sign indicates critical liver dysfunction, and early intervention can be life-saving. Supporting liver health through regular bowel movements and avoiding toxins is crucial for prevention. 10. Easy bruising and bleeding, a clotting concern. Easy bruising and bleeding in liver disease stem from the liver's reduced production of clotting factors and thrombopoietin, a hormone that stimulates platelet production in the bone marrow. Clotting factors are proteins essential for blood clot formation, while platelets help seal blood vessels. In liver disease, lower clotting factor levels and fewer platelets increase bleeding risk. Additionally, an enlarged spleen, common in liver disease due to portal hypertension, sequesters platelets, further reducing their availability. This leads to frequent, large bruises or prolonged bleeding for minor injuries. Symptoms like nosebleeds, gum bleeding, or dark stools may also occur, signaling serious liver impairment. Prevention focuses on addressing liver disease causes, such as limiting alcohol, managing metabolic syndrome, obesity, diabetes, and treating viral hepatitis. The hepatitis B vaccine and curative treatments for hepatitis C are critical tools. If you notice unexplained bruising or bleeding, seek medical evaluation promptly, as these signs may indicate advanced liver disease requiring urgent management. Causes and prevention. Protecting your liver. Liver disease stems from preventable causes like alcohol consumption, metabolic syndrome, linked to obesity and diabetes, and viral hepatitis B and C. Excessive alcohol scars the liver, leading to cirrhosis, while metabolic syndrome, now a leading cause, promotes fatty liver disease. Hepatitis B and C, if untreated, cause chronic inflammation and liver damage. Prevention is key, as liver disease is often irreversible without a transplant. Limit alcohol intake to protect liver tissue. Maintain a healthy weight through diet and exercise to prevent fatty liver. Get vaccinated against hepatitis B, and seek treatment for hepatitis C, which is now curable. Regular checkups can detect early liver issues, allowing lifestyle adjustments to halt progression. By recognizing these 10 signs, nail changes, ascites, abnormal veins, skin changes, jaundice, muscle wasting, Dupuytren's contracture, Asterixis, Fetor Hepaticus, and easy bruising, you can take proactive steps. Consult a healthcare provider if you notice these symptoms, and prioritize liver health through informed lifestyle choices to ensure long-term vitality. We've just explored the top 10 signs of liver disease, crucial clues your body might be sending about your liver's health. From nail changes like Muehrcke's lines, Terry's nails, and clubbing to abdominal fluid buildup in ascites, these signs highlight the liver's vital role in detoxification and metabolism. Abnormal veins, such as caput medusae and esophageal varices, signal dangerous portal hypertension, while skin changes like palmar erythema and spider nevi point to hormonal imbalances from liver dysfunction. Jaundice, with its yellowing of skin and eyes, reflects bilirubin buildup, and muscle wasting shows the liver's struggle to process nutrients. Dupuytren's contracture, Asterixis, flapping tremor, and Fetor Hepaticus, musty breath, indicate advanced liver issues, often tied to toxin accumulation affecting the brain. Easy bruising and bleeding reveal the liver's impaired clotting factor production, underscoring the need for early detection. Finally, preventing liver disease means limiting alcohol, managing weight to avoid metabolic syndrome, and addressing viral hepatitis through vaccines and treatments. Your body speaks to you through these signs. Listen closely. If you notice any, consult a healthcare provider promptly to catch issues early. At Ageless Living, we're here to empower you with knowledge to stay vibrant and healthy. Loved this deep dive into liver health? Subscribe to our channel for more life-saving health insights delivered straight to you. Hit that subscribe button, tap the bell for notifications, and join our community of curious, health-conscious viewers. Share this video with someone who needs to know these signs, and let's keep the conversation going in the comments. Stay curious, stay healthy, and we'll see you in the next video.